Take Back Your Health Now, Episode 21.
You're listening to the Take Back Your Health Now podcast, the show that interviews the top doctors, athletes, trainers, and entrepreneurs to help you find the holy grail of health. Now here's your host, Dr. Dan Margolin.
This is Dr. Dan Margolin with another segment of Take Back Your Health Now, where we pull out all the stops in search of health's holy grail. We are really excited to have Dr. Michael Greger on the show. He is a physician, New York Times bestselling author, and internationally recognized professional speaker on a number of important public health issues. Dr. Greger has lectured at the Conference on World Affairs, the National Institutes of Health, and the International Bird Flu Summit, among countless other symposia and institutions, testified before Congress, has appeared on shows such as the Colbert Report and the Dr. Oz Show, and was invited as an expert witness in defense of Oprah Winfrey at the infamous Meat defamation trial. Dr. Greger's recent scientific publications in the American Journal of Preventive Medicine, Critical Reviews in Microbiology, Family and Community Health, and the International Journal of Food Safety, Nutrition, and Public Health explore the public health implications of industrialized animal agriculture. Dr. Greger, welcome to the show, sir.
So happy to be here.
So, Dr. Greger, How Not to Die is a pretty shocking title for a book. What made you want to write that, and how'd you come up with the title?
Oh, it's not, how to not die, but how not to die, as in, prematurely in pain after a long chronic disabling illness. The good news is, though, that we have tremendous power over our health, destiny, and longevity. The vast majority of premature death and disability is preventable with a plant-based diet and other healthy lifestyle behaviors, and I wanted to get that word out there.
You know, it's funny because I've interviewed like a Dr. Joel Furman, Dr. Stephen Gundry, who also are medical doctors that are really going more towards reversing diseases and things like that with a more vegetable-based diets and things like that. How did you first discover this? Like, what made you? Because it's not, when you look at the medical field, a lot of the doctors are more medically based as far as pharmaceutically. How did you sort of break out of that?
I was actually, I'll start with my grandma. I was just a kid when the doctor sent my grandma home in a wheelchair to die. She was diagnosed with end-stage heart disease. She had so many bypass operations to basically run out of plumbing at some point. Confined to wheelchair, crushing chest pain. Her life was over at age 65. Doctor said there's nothing more they could do. But then she heard about this guy, Nathan Pritikin, one of our early lifestyle medicine pioneers, and became one of his early success stories. She's actually featured in his book, in his biography. He talks about Frances Greger. That was my grandma. It's kind of a live-in program where, placed on a plant-based diet, a graded exercise program. They wheeled her in, and she walked out. Within a few weeks. She was walking 10 miles a day, went on to live another 31 years till age 96 to continue to enjoy her 6 grandkids, including me. So it was really this kind of miraculous recovery that not only inspired one of those grandkids to pursue a career in medicine, but granted her enough healthy years to see me graduate from medical school as well. So it's really all thanks to her that I not only practice medicine, but I practice the type of medicine I do, lifestyle medicine.
Wow, that is incredible. What a great story. So if in order not to die, like what are the things that we should avoid? Like how should we live our lives?
The first half of the book, I just have 15 chapters on each of the 15 leading causes of death, on down the list, starting with heart disease, moving on to various cancers and stroke and, Alzheimer's, all the way down diabetes, and talk about the role diet may play in preventing, arresting, or reversing each of our 15 killers. And then the second half of the book is more really just kind of, I didn't want it just to be a reference book. I wanted it to be kind of a practical guide on, translating this mountain of evidence into day-to-day decisions. So that's what became the second half of the book, where I center my recommendations around a daily dozen checklist of all the things I try to fit into my daily routine. So, every day I encourage people to eat, dark green leafy vegetables, the healthiest types of vegetables, berries, the healthiest types of fruits, beans every day, a tablespoon of ground flax seeds, the quarter teaspoon of turmeric, the best beverages, how much exercise to get, the best sweeteners, etc., on down the list, in hopes that I can inspire people to add more healthy foods to their diet.
Are there specific, like you said in the beginning of the book, you list out some of the specific things. Are there specific, like hypertension or heart disease? How would somebody avoid that? What would be the remedy for that, I guess, or how would you reverse that?
Well, so both of those diseases can be not only prevented and stopped in their tracks, but actually reversed by treating the cause, which is primarily an unhealthy diet. So, for example, we've known since July 23rd, 1990, when Dr. Dean Ornish published his landmark lifestyle heart trial in The Lancet, that heart disease, our number one killer of men and women, can be reversed with a healthy enough diet and other lifestyle changes. So we put people on a whole food plant-based diet, and able to, dissolve plaque away, opening up arteries without drugs, without surgery. So we've effectively had the cure to our number one killer for decades now, yet hundreds of thousands of people continue to die of this preventable, arrestable, reversible condition. Same thing with hypertension. The only, I think, important thing to note, though, is if you are taking blood pressure pills, if you're on blood pressure medications, you need to make these healthy lifestyle changes in conjunction with your prescribing physicians, because doctors underestimate the power of nutrition to rapidly reverse disease. And look, you can't have normal blood pressures and be on multiple blood pressure medications. You drop your pressures too low, it could be dangerous. You can, get dizzy, fall over, hit your head or something. So your doctor has to wean you off these drugs as you treat the cause, as you get healthier and healthier. So you can't just do it on your own and take the same amount of drugs as you were taking before. Wow,
that's so. It's funny when you think of changing your diet. In my mind, you almost think of a slow reversal. Okay, you'll do this; it'll take a few years. But you're saying a lot of these reversals are how long? What time period if you followed it strictly?
Well, it depends. So, it can be a matter of days in terms of type 2 diabetes, weeks for hypertension and symptomatic heart disease. So, for example, angina. Now, in a few weeks, you're not getting that. You're actually opening up the arteries. What you're doing is not changing the structure of your arteries in that kind of time frame, but you're changing the function of those arteries. So, for example, nitrate-containing vegetables like dark green leafy vegetables and beetroot can enable your arteries to open up, to dilate better. So even if they're clogged off with, cholesterol-laden plaque, you can get some better function. So within weeks, you can get, 80-90% drop in angina attacks. That's what you'd get with, stenting or bypass surgery, but you get it without the surgery by treating the actual cause instead of literally bypassing the problem.
Wow, really revolutionary concepts, right? I mean, I know they've been around for decades, but as far as if you walked into a hospital right now and you said in the ER, hey, this is what I want to do, what kind of a reaction do you think you would get?
Well, I mean, if you're in the ER, if you have a clot in your heart, if you are in a kind of acute cardiac arrest, there are cases in which, if they rush you to the angiography suite, they can actually go in and dissolve that plaque away and save your life. But for chronic, stable angina, the kind that people suffer with at home, the stenting procedures don't work in terms of decreasing morbidity and mortality. They don't actually extend your lifespan. They can have symptomatic relief, but why just get symptomatic relief when you can actually reverse the course of the entire disease? Now, typically, most doctors these days have heard about Ornish's work, and so when I confront them and say, well, wait a second, why aren't you prescribing this to all your patients? Typically you'll get this kind of patronizing response that, well, my patients won't do it. It's like, oh, I can't even get my patients to stop smoking. Forget it. There's no way they're going to change their diet. But I try to remind them that, look, that decision is not up to you. I mean, you are making up your patient's mind for them by not informing them of this even as an alternative. I think you'll be shocked at how many people, at the broad, diversity of people that will, if given a choice to get their chest cracked open or take drugs every day for the rest of their life, would actually choose to treat the cause and clean up their diet and lifestyle and live longer because of it.
Wow. No, I agree with you 100%. As I'm a podiatrist, I see an increase in diabetes, obesity, even cancers. Are these things that are also fairly simple to treat based on diet?
Oh, and gout too. You're probably at the front lines.
I'm telling you, gout. The day after St. Patrick's Day, my phone goes off the hook.
Oh God, that's so sad. Oh no.
Absolutely.
Well, look, but it's actually the same kind of diet, the same kind of, lots of meat and as you mentioned, the alcohol component can lead to this, the hyperuricemia, high uric acid levels in the blood, which can crystallize in your joints, such as your big toe, and cause this painful gouty arthritis. And so that's a disease that can be prevented, treated with diet. And some of the others you mentioned too, the type 2 diabetes certainly can be reversed with diet. After Dean Ornish conquered our number one killer, heart disease, they moved on to killer number 2, cancer. So they took a group of men with early stage prostate cancer, put them on the same kind of plant-based diet that they used to reverse heart disease, and got a reversal in the progression of their prostate cancer. So what they saw is on average, their PSA levels went down as opposed to the control group where they continued to rise. And so this suggests a shrinking of their tumors just because of, diet, exercise, smoking cessation, all the just kind of common sense, healthy behavior suggesting, look, our body wants to be healthy all along, kind of the normal state.
Right.
It should be health. And only when we, whack ourselves in the shin 3 times a day, breakfast, lunch, and dinner, are we going to, have to deal with this kind of inflammation and these kind of oxidative insults, which contribute to some of these diseases.
Dr. Greger, the whack yourself in the knee kind of thing, what is that? Like, what are we eating? Is it the genetically modified foods, or like what is it, too much meat? I mean, what is it that's actually causing all this, and how destructive are the foods that we are eating?
Well, the components within the food. I mean, so we don't eat nutrients. We eat foods, but in general, we need to cut down on trans fats, saturated fats, sodium, added sugars. I mean, so these are some of the food components that are contributing to disease. Those are kind of the traditional ones, but there's a bunch of really new, interesting stories in terms of effects on our microbiome. There's this something called TMAO, trimethylamine oxide, which is actually formed from the carnitine and the choline found predominantly in meat, dairy, egg, seafood, which is converted by certain gut bacteria into something called trimethylamine, oxidized in the liver into trimethylamine oxide, which can then attack our arterial lining, increase the cholesterol buildup, and increase our risk of heart attack and stroke and heart failure and kind of on down the list. But what's interesting is you need these, but if you don't have these pathogenic bacteria in your gut, you don't produce any of this regardless of what you eat. So what they did is, this is at the Cleveland Clinic at Dr. Hazen's group, where they took vegans, fed them a steak, and they didn't make any TMAO. He said, wait a second, steak is packed with carnitine. Well, yeah, it's not the carnitine, it's the but if you eat steak every day, then you feed carnitine-eating bacteria. They grow and they multiply, and they can create this toxic TMAO. But if you eat healthy, then you don't foster the growth of these pathogenic bacteria, and so you don't make TMAO. So what that's saying is that it's really the day-to-day stuff that adds up. It doesn't matter what you eat on your birthday, your holidays, or special occasions, but on a day-to-day basis, we really should eat clean diets. And what that means is one that minimizes the intake of meat, eggs, dairy, and processed junk, and maximize the intake of fruits, vegetables, legumes, which are beans, split peas, chickpeas, and lentils, whole grains, nuts and seeds, mushrooms, herbs, and spices, basically real food that grows out of the ground. These are our healthiest choices.
Dr. Greger, unfortunately, growing up eating a lot of meat and potatoes, right? If you were to say what percentage of your diet you could get away with, I mean, maybe I'm sure it varies for each person, but as a standard, is there 10% fat? Like what percent would you say would be a safe percent that you could eat red meat, chicken, dairy, eggs, all those kind of things?
Well, so if you look, for example, at the Okinawa Japanese, one of our longest living population, they eat 98% plant-based diets. So about 70% of their diet, calorie-wise, is sweet potatoes, purple and orange sweet potatoes. And they're about 2%, they don't even eat dairy, but about 2% of their diet, eggs and fish. And so they live extraordinarily long, healthy lives. So that would suggest that those 2% would work. Though the longest living population, so they're the second longest living population, the longest living population doesn't eat any meat at all, actually squeezes that down to 0%. And that's the California vegetarian Adventists, the Seventh-day Adventists, which is the kind of longest living so-called blue zone population in the world.
Wow.
But that they sort of live about 10 years longer than the general population. That's a variety, and that's a combination of both their diet plus the low smoking rates and other healthy lifestyle behaviors.
What is the length of time? What are we talking, over 100, or what is the length of time?
Well, no. So the average life expectancy, I think it's 87 for men, 89 for women, and so that's about 10, 12 years past the average life expectancy of the general population is about 76. And they do have a lot of centenarians. In fact, there's a centenarian cardiac surgeon. Who's actually still doing open heart surgery over the age of 100.
Wow!
What that show? It's not just about the number of years. It's about your vitality, your health.
Sure.
So not only are we living progressively shorter years. For example, our next generation may actually be the first American generation that lives shorter lives than their parents, largely due to the obesity, diabetes epidemics. But they're living fewer healthy years of life where there's significant disability. And so, we want our golden years to be happy and healthy. And we can do that by taking care of ourselves. And, this is all just kind of common sense stuff in terms of not smoking, eating healthy, wearing our seatbelts, etc.
Sure. Dr. What about probiotics, supplements? How does that fit into your viewpoint?
So we're learning more and more about the amazing powers of a healthy gut flora to benefit not just intestinal health, but throughout our body, immune health, maybe even mental health. It's really quite extraordinary, the so-called microbiome revolution that's going on. But the answer is not to take probiotic supplements, because all that does, so you can temporarily take probiotic supplements, you can seed your gut with healthy bacteria. But then if you don't feed those bacteria, so-called prebiotics, if you don't feed those healthy bacteria, they'll just die off. So you have to take them every day. So you can take probiotics every day for the rest of your life. Or how about you just feed the few good gut bacteria you have with prebiotics, which are fiber and resistant starch, which is found concentrated in whole plant foods. You eat whole plant foods, healthy foods, and you feed the gut bacteria, and then they grow and they multiply. And so you can foster the growth of your own good gut bacteria. So that's really what the focus should be on. Now, if you just do a course of antibiotics that wipe out your gut and you're experiencing symptoms, okay, certainly I can imagine, repopulating your gut with good bacteria. But once they're repopulated, then you just have to feed them, keep them healthy by eating the foods that they eat. we eat fiber, we feed them, they feed us right back with these byproducts of fiber. They then get absorbed back into our system and have beneficial systemic effects.
So we're really being gardeners to our own gut flora. I mean, that's really the basics of it.
Tending our inner garden.
I love it. And well, I'm a parent. My daughter's 8 years old. You know, there was a period where she was on antibiotics for an ear infection at some point. Should I be worried about that? I mean, how would that affect her growth?
Oh, so it depends what kind of antibiotics. So there's some antibiotics. I mean, antibiotics are meant to be absorbed into the system. Right. I mean, so if you have an ear infection, a sinus infection, you take antibiotics, you want those antibiotics to be absorbed into your bloodstream because they got to circulate throughout your body. You don't need them in your gut. You need them in your bloodstream. You need them in the ear. You need them in the sinuses. So most antibiotics are meant to be absorbed in the small intestine. It's only there are certain antibiotics that are designed not to be absorbed, to stay in the intestine, so they make it down to the colon, wipe out your gut flora, which can be done for certain bacterial infections of the gut. But many antibiotics don't wipe out your gut flora because they get absorbed before they ever make it down to the large colon, which is where most of our gut flora are.
What would be an example of an antibiotic that would wipe out your gut flora?
Oh, so it's something like metronidazole or something where the whole point is to, I mean, you have something like, C. diff or some really horrible intestinal, infection. You try to wipe it out. Unfortunately, often that disease is caused by taking other antimicrobials that wipe out your good gut flora, and then the bad bacteria can take over. But look, so how you know whether you have a good gut flora is if you had symptoms. So, for example, if after taking antibiotics, you have chronic diarrhea, which lasted 15 days or more, then you'd be like, okay, we've disturbed the gut flora. Maybe, it's worth taking a course of probiotics. Now, of course, probiotics don't work unless they're actually alive. So that's why you find them in the refrigerated section of your natural food store. But just because they're refrigerated then doesn't mean they haven't been sitting on a hot truck for a week. So what you do, you got to take the probiotics home, and what you do is you just do, as a test, you open up a capsule into a little bowl of milk, can be any kind of milk. And then you have a control bowl of milk, which you didn't put the capsule in, and you come back in the morning after overnight, and the bowl should look different. The one you add the probiotics to should be filmy and frothy and gross and yogurty when you pour them down the sink. That shows there's actually live bacteria doing their thing. If they both look the same when you dump them down the sink, well, the probiotics are dead. You take them back to the store, you demand a refund, you get a replacement.
Right.
But it's important to do that every bottle you get, because it doesn't work unless they're actually alive.
That is a great tip. Thank you for that, sir. So let me ask you, what do you feel is the biggest threat to the health of Americans at this point?
Oh, well, I mean, it's the Global Burden of Disease Study, the largest study of risk factors to date in human history, funded by the Bill and Melinda Gates Foundation, found that the number one cause of death in the United States and the number one cause of disability is our diet, followed by smoking. But now cigarettes only kill about 500,000 Americans every year, whereas our diet kills hundreds of thousands more. So it's the food. It's what we eat. That's our number one determinant of longevity and health.
Wonderful. Well, the show is really about looking for the holy grail of health. So if I were to ask you what the holy grail of health is, I guess it comes back to really the diet and really going towards a more vegetarian-based diet.
Yeah, it's really what we eat. I mean, that's our number one exposure to the outer environment. It's actually not what we breathe. It's not what comes in contact with our skin. Because of all the tiny little folds in our intestinal tract, our number one exposure to the outside environment, whether they're talking about toxins, whether they're talking about anything, is actually through our gut. And so what we slather the lining of our gut with 3 times a day, it's perhaps no surprise that it should have an effect on our health. We are what we eat, literally, physically. We are created out of, basically food, air, water. There's not much else. Every few months, we basically, many of the rapidly multiplying tissues in our body are completely replaced. And so what are they replaced with? It's what we're eating. And so we could use some really shoddy fast food building materials, right? Or we could, think long term and use the best materials to create our body in the best way possible.
Wonderful. One more question. So you've dealt with other issues like bird flu, and what makes confronting some of these more contagious illnesses so difficult in our society right now?
Oh, well, yeah. So, for some of these diseases like bird flu, mad cow swine flu, in one hand, it doesn't matter really what you eat because it can be transferred person to person. On the other hand, it matters completely what we as a society eat because the way we raise some of these animals can in these, overcrowded, unhygienic conditions can breed these emerging pathogens, like some of these dangerous strains of bird flu, which can then have devastating, consequences regardless of what we eat. And so what we need to do about it is we really need to change the system by which we make our food and move, for example, in animal agriculture to more kind of pasture-based systems where they actually have some room to breathe. And so we don't foster the growth of some of these foodborne bacteria and potentially, person-to-person epidemics, which could be, really devastating looking back in history.
Sure. Well, Dr. Greger, I want to thank you, sir, for being on the show. How would people that want to find out more about you get in touch with you? How would they do that, sir?
Best thing to do is go to my nonprofit site, nutritionfacts.org, where all my work is available free. There's no ads, no corporate sponsorship, strictly non-commercial, not selling anything. Just put it up as a public service, as a labor of love, as a tribute to my grandmother. I encourage people to check it out, nutritionfacts.org.
Your grandmother would be very proud of you, sir. Thank you.
Aw, thank you.
This episode is sponsored by New Jersey Foot and Ankle Center in Oradell, New Jersey. Remember, when you have a foot problem, you've got a foot doctor in the family. Weekend and evening appointments are available. Call us at 201-261-9445. Once again, that's 201-261-9445. Thanks for listening. Check out the show notes over at drdanspeaks.com. If you're loving the show, head over to iTunes and leave us a review, and we'll catch you next time. Voiceovers for this episode were provided by Randy Ramos Jr. To see and hear more of his work, visit randyramosjr.com. jr.com.